thanks for being here this morning. Good morning. And I really want to thank you all for being here to mark this truly extraordinary milestone for Children's Nebraska, for our state and for our region, and most importantly, for the children and families we serve. I'm Chanda Chacon, President and CEO of Children's Nebraska, and I'm honored to officially welcome you to the Behavioral Health and Wellness Center. This center reflects our mission to improve the life of every child, and it represents a commitment that we've made and continue to make to children's mental health and emotional well-being. It's a promise that behavioral health care is not optional, it's not secondary, it's essential. This facility extends our pediatric medical campus and underscores an important message. Mental health is health. We're honored to be joined here today by leaders and partners who share that belief. Please join me in welcoming Nebraska Governor Jim Pillen and First Lady Suzanne Pillen, Dr. Steve Coursey. We'll clap, yeah. Dr. Steve Coursey, CEO of the Nebraska Department of Health and Human Services, and Omaha Mayor John Ewing. Your leadership and partnership have been essential and instrumental in advancing solutions for children and families across our city, our state, and our region. There's one critical and trusted partner that I want to recognize who could not be with us here today, but whose vision and spirit is truly ever present in this facility. I want to extend our deepest gratitude and respect for Ken Stinson and the Mental Health Innovation Foundation. Without Ken's vision, advocacy, and relentless commitment to extending pediatric mental health care in our region, this facility would not have been possible. His leadership helped bring this project from an idea into a reality that will serve children for generations. Please join me in thanking Ken and our incredible MHIF partners and donors here today. So this facility was designed truly in direct response to what families have been telling us for years. The need for pediatric behavioral health care continues to grow, and too often families are struggling to find the right care at the right time. The Behavioral Health and Wellness Center changes that. This nationally distinctive center provides the full spectrum of pediatric mental health services for children and families, from outpatient services to crisis stabilization to inpatient care, all under one roof. Any child up to 19 years old can be seen on a walk-in basis. No referral is needed. When a child and family arrive here, they will be met with expertise, support, and compassion, no matter where they are in their journey. Equally important, this center brings behavioral health care alongside physical health care on our campus. That integration allows us to treat the whole child, reduce fragmentation, and support families during some of the most challenging moments of their lives. This vision would not have been possible without strong collaboration and strong community support that's behind it. And I want to thank the Nebraska legislature and many of the partners, the donors, community leaders, clinicians and team members, and most importantly, patients and families who have believed in this work and who've truly helped move it forward. This center is the result of what can happen when the community comes together around children. Because of all of us pulling together in the direction of hope, we are ready to transform pediatric mental health care in our region. It's now my honor to invite Governor Jim Pillen to share a few words and reflect on the importance of expanding behavioral health care for Nebraska's children and families.
Well, good morning, everybody. What an extraordinary day to be Omaha, to be Nebraska. You talk about bringing community together and solving problems. Shannon, just a gigantic congratulations. I've really enjoyed the time we've known each other, and thanks for everybody giving a shout out to Ken Stinson. I've had the privilege to know Ken for almost 25 years, and there's incredible people in Nebraska. There's incredible people that have made phenomenal differences in the community of Omaha and the state of Nebraska. Ken Stinson is one of the legends, and Ken, hopefully you're listening. Ken, we just a gigantic thank you. Almost 5 years today, this calling happened to Susan and I to be here. And everywhere I've been in the state of Nebraska, every single place, whether I've been to critical access hospitals or hospitals and emergency rooms across the state, we deal with behavioral and mental health problems that we're not equipped to handle. Every person I met across the state in blue said we countlessly have mental health challenges to deal with that we're not equipped to. So this facility is going to be an extraordinary step to help start with kids and be ahead of that. This facility is phenomenal. It's off the charts. But guess what? We all agree it's about the people. And Chanda, the team you have put together is second to none. Everybody's coming here because it's the people of Nebraska, and this will be the best facility in the United States of America. Congratulations. Really good stuff. If I can brag a little bit about the state of Nebraska, unicameral, and what our administration's done. Almost 3 years ago, 15 days in, I got a call from the governor of Oklahoma, Kevin Stitt. He said, "Pillen, how you doing?" I said, "I'm doing okay, Kevin, trying to figure a few things out." He said, "Well, I don't want to get in your grill, but I just want you to know I don't understand." He said, "I have an office of the governor of Oklahoma in Washington, D.C. And he said, we rank 10th out of 50 states in getting federal dollars to Oklahoma. He says, I don't know what y'all been doing in Nebraska, but you rank 49 out of 50. So I said, with my competitive spirit, I said, well, we're not going to be second. We're not going to get beat by Oklahoma for very long. My point would simply be we've worked very hard. It doesn't matter what administration to develop partnerships. I learned a long time ago, you got to figure out the market. I really didn't, when I bought my first farm, really didn't want to be involved with the federal government payment. My father said, Jim, how are you ever going to buy another farm? Because all your neighbors are in. My point I want to share is we worked very, very hard to bring more than our fair share of federal dollars to Nebraska. And one piece that we're really proud of to be supportive is we've been able to get $1 billion, that's with a B, $1 billion a year from the federal government to come to Nebraska that had been passed on the previous 12 or 13 years. So we've gotten $1 billion, that's with a B. That means roughly $500 million a year comes to the Omaha area hospitals. So far, it hasn't happened as quick, but I think so far, Children's Hospital has received $120 million, and there'll be another $120 million by the end of 140, and then so by the end of this June, there'll be $240 million of federal dollars for Children's Hospital. That's making sure we get our fair share, and we'll continue to work to make that happen every year. For Omaha, so far for Omaha hospitals, with that number included, has received $400 million. By June, by the end of June, it'll be $800 million of federal dollars coming. I call that equity infusions into our health care, and in working with the Hospital Association, a key piece of that is for investments to help us with our behavioral and mental health. I think that's really important. The other one I want to brag about a little bit is early on, I said, I need to go testify at this hearing. And it was for certified community behavioral health clinics. And I was told, well, you can't testify at that. Why is that? Well, it's because the Democrats put the bill forward. A Republican governor's never done that before. And I said, well, they're going to now. So we were really, really excited to partner because why that's a big day to talk about. It has just gotten executed. It has become law, and we have 7 certified community behavioral health clinics now across Nebraska, 7. 71% of the funding of that is taken care of by the federal government. We believe that's another piece of having a gigantic impact for mental health, for behavioral health, and then all of the associated clinical problems that arise. So we're excited about that taking place. And then maybe lastly, helping with kids, technology. A year ago at this time, we were told you have no chance to go up against big technology because you're going to get crushed. We passed 4 bills: no phones in school, no phones bell to bell, no limiting access to social media, and limiting the access for kids to all the addictive natures of technology. We and the unicameral got 4 out of 4 on it, and that's a piece of making sure maybe your beds don't fill up as much so that we can address that. And maybe lastly, I think that what I want to just say for all of us, I call it 738-55. It's communication. 7% is our words, 58% or 38% is how we say it, and 55% is our body language. Our body language. Every one of us, isolation leads to so many mental health challenges. Every single one of us, if we just step up and have some body, have some positivity, and just smile at somebody, say good morning instead of looking at our phone and looking away. If every one of us just does that, we can have an incredible impact on helping mental health. We don't have to be a PhD to make a difference. We can all make a difference in our walk. With that, I talked too long, but I just want to just say again a gigantic congratulations. There's many, many people. This is a beautiful example of private-public partnerships working together for our kids. We all agree. Our kids are our future. We're never going to give up on kids. Godspeed. Congratulations. Thank you.
Thank you, Governor, for your leadership and for recognizing that children's mental health is essential for the future of our state. Your support sends a very clear message. Families across Nebraska know that they're seen, they're valued, and they're worth investing in. This work does not happen in isolation, as we've said. It takes strong local partnership also to turn vision into a reality. I'm grateful to welcome a leader who understands the power of community and collaboration in building a healthier future for our children. Please join me in welcoming Omaha Mayor John Ewing.
Good morning, everyone. Well, like the governor, I'm a little competitive as well. And Chandra and I talked about this, and it was going to be between us, but the governor already said it, so I'm going to say it. I am proud to have in Nebraska the best wellness and mental health institution in the country. So congratulations, Chandra. Today marks an important day in the community. It is an answer to a lot of prayers in Omaha from families, from healthcare professionals, and from teachers, friends, and neighbors, and others who have felt helpless in the face of a child's mental health issues and needs. Today also shows what is possible when the public and private sectors come together to do something big. Today shows that we can stand unflinching in the face of a hard problem and together work to solve that problem. In this case, it's by providing enough beds, a warm, inviting environment, and the kind of care our young people in crisis need to heal. It is a sad statement of our time that our most cherished resource, our young people, are facing rising rates of anxiety, depression, and suicide. Like you, I want to hold them in my arms and protect them against this and help them find ways out. This behavioral and wellness center, however, is the hug our community can give. It is a sign that says, you matter and are vital. We love and need you. So to all those who made this possible, especially Ken Stinson and this great team at Children's, including their board of directors and all the funders who partnered with them, I say thank you on behalf of the Omaha community. I say thank you on behalf of the Nebraska community. I say thank you on behalf of the regional community as well, because this is really about helping kids, no matter where they are, be able to deal with the most difficult moments in their life. And we can be there for them because of this great work and this great partnership. So thank you from the bottom of my heart. I also want to thank all the caregivers in this room for going into such an important field and dedicating your lives to the health and well-being of our young people. Our young people are our future, but I say they are also our right now. So it's critically important that we are investing in them now as well as into the future. So thank you. It's great to have this facility to be able to serve our young people in their most critical moments. It's great to be able to serve our families. Nebraska, Omaha, we are about people. And so I always say we are one Omaha, so thank you.
Thank you, Mayor Ewing, for your leadership and support to children and families in our community. Now, we've talked a lot about people and how important people are. I'm so pleased to welcome to the podium the true power behind the Behavioral Health and Wellness Center here at Children's Nebraska, Renee Rafferty, our Senior Vice President of Behavioral Health and Wellness at Children's Nebraska.
Good morning. What we are celebrating today is not just a beautiful building. We are marking a new day in how pediatric behavioral health care is delivered, experienced, and valued. The Behavioral Health and Wellness Center represents a fundamentally different approach to care. We've designed this center around a simple but powerful principle. Children deserve compassionate and connected behavioral health care that meets them where they are. Our no wrong door philosophy ensures that every child will never be turned away in a behavioral health crisis. They are met, welcomed, and supported and guided to the care that meets their needs. Whether a child needs urgent assessment, short-term stabilization, or inpatient hospitalization, or ongoing treatment, they are in the right place. The environment itself is intentionally designed and informed by research. You can see the beautiful natural light, the graphics that have nature in them, the sensory-informed materials that allow for self-regulation for families and for kids. These spaces promote safety and healing. They are not merely aesthetic choices, they are clinical tools that support healing, especially for children experiencing trauma or anxiety or crisis. This center allows us to deliver care in a way that I would have never imagined in my lifetime. With support from our generous local donors and Mental Health Innovation Foundation, we have been able to build a strong foundation of technology. The James M. Cox Foundation has also brought to us the incredible ability to build on that foundation and bring virtual reality, augmented tools to help kids when they're experiencing anxiety and stress, interactive panels that will allow kids to have choices in their most darkest moment. They can control the lighting, they can play a game, they have these opportunities through technology that we would not have had without the generous donation. These innovations are groundbreaking. They are based on evidence and best practice. None of this works, though, without our amazing people. They brought this vision to life and are making all the difference. The center is powered by a multidisciplinary team who's deeply committed to the health and well-being and a trauma-informed care approach. We are proud of our unique culture and the approach we have built here and the incredible gifts and talents of our team. What we are building here does not exist elsewhere in our region. This center sets a new standard for pediatric behavioral health care, one that treats mental health as essential, one that prioritizes dignity and hope. While facilities and models and innovation truly matter, the measure of this work is how we impact families. To understand what this center means to families, it is important to hear directly from one of those that we have served. I am honored to introduce a parent whose family experience reflects the kind of care we strive to provide every day. Please join me in welcoming Laura Baker.
Good morning, and thank you all for being here. It is truly an honor to stand in this new life-changing building. I am so grateful to Children's Nebraska for creating a space for families like mine, and to the leaders and donors and community members and caregivers who made this center possible. This building exists because people believe that families like mine deserve better access to care. I am here to share my family's story. My hope is that when you hear a parent or a child speak openly about their behavioral health experience, that it's able to encourage and help others. Our family's journey began here at Children's Nebraska 8 years ago when my daughter Emma, our oldest, was diagnosed with brain cancer at the age of 14. As many families know, when a child is sick, the impact goes far beyond that one child. It ripples throughout the whole entire family. Parents, caregivers, siblings, all carry their own weight of that experience. But what mattered most is that Children's Nebraska didn't just treat a diagnosis, they treated our whole family. They understood that healing does not happen alone in isolation. 4 years later, we would return to Children's Nebraska for yet a different reason. My youngest daughter, Abby, she was struggling. She was diagnosed with an eating disorder. At first, the signs were very subtle. She stopped finishing her meals. Her favorite foods weren't quite her favorite anymore. She exercised a little bit more. And to some, that wouldn't ring off any alarms. But to me, as her mother, I knew something was wrong. Reaching out for help is not always easy. Fear, uncertainty, stigma, they can all hinder and make that first step overwhelming. But asking for help, it changed everything. From the moment we entered the eating disorder program at Children's Nebraska, we knew Abby was in the right spot. The care team spoke directly to her in her language. Then they included us at the same time as parents with clear communication, compassion, and lots of education. Abby was never defined as an eating disorder there. She was treated as a whole person. Her care included talk therapy, structure, connection, art therapy, recreational therapy, dietitians, and lots of education. Our family was included throughout this whole process because Children's understands when a child is healing, a family must heal and grow as well. Children's also understands that mental health is health. Our brains affect every part of our bodies. Standing here today, I can attest, my heart is racing, my palms are sweaty, my belly's a little nervous. That certainly is my brain giving signals to my body. We easily accept that when it's a physical illness like a virus or a bacteria. We need to accept that also when it's related to mental health. Life brings illness, it brings stress, it brings grief, it brings change, and those experiences all affect how we function. Needing help because of that, it's not a failure, it's just being human. That is why this Behavioral Health and Wellness Center matters so much. This building sends a clear message to families across our region. There is no wrong door. If your child is experiencing a behavioral health crisis, this is where you go. Help is here. You do not have to navigate this stuff alone. Even the design of this beautiful facility reflects that care. It's calm, it's intentional, it reduces the stress instead of adding to it. And when families are overwhelmed, that kind of thoughtful environment really matters. A lesson our family has learned is the importance of telling our story. A label becomes less frightening when we understand that full picture. And compassion and empathy, it grows when people really truly understand what others are going through and carrying. If there's one message I hope that families take away from today is this: it's just important to ask for help because you're not alone and this isn't your fault. And there is so much hope and healing, even when it seems so very distant. This place exists so families can find that support when they need it most. To the care team at Children's who show up every day with such skill and compassion, thank you. And to the donors and our community members who made this beautiful center possible, thank you for holding families like mine up in hope. And to Children's Nebraska, thank you for your commitment to continuing to treat the whole child and the whole family. Healing happens one step at a time, and this center will help so many families take that first step and walk the journey with them. Thank you so much.
Thank you, Laura. Thank you so much for your courage, your generosity, and your trust. When families choose to share their stories and give voice to what so many others have experienced, we all find a sense of hope. Your words truly remind us of what matters. Your story reflects something larger than any one experience. It reflects that we all have behavioral health conditions. And it reminds us the impact that we are going to have on families and where families are going to be able to be met with behavioral health expertise during a time of their most challenging experience. At this time, I would like to invite our ribbon cutters to come forward. As we do, let us remember the ribbon cutting represents more than the opening of a building. It represents access and compassion, and it represents hope for every child and family who will walk through these doors. Come on up.
So, tomorrow morning, the Behavioral Health and Wellness Center will open its doors to children and families, and a new era of hope and healing will begin. Thank you for joining us today to celebrate, and thank you for your shared commitment to improving the lives of children. Have an awesome day.